I'm Alice. Welcome back to Men Health 30, where we do not shy away from the truths about men's health, especially sexual health. In the previous video, I walked you through what blood and semen could be warning you about and the possible causes behind it. But today, we will go deeper into a fear that many men are silently hiding. Blood and semen, could it really be a sign of prostate cancer? You are masturbating, feeling healthy. Everything seems normal until one day, you discover that your semen has a pinkish color or streaks of red blood. You freeze. You panic. You rush to search online, and the first two chilling words that hit your eyes are cancer. Direct hit. The critical question is, blood and semen, is it just a minor blood vessel rupture, or is it a warning bell from inside your body? In today's video, I will help you distinguish between a benign condition that can occur after masturbation and the truly dangerous signs, which could be related to chronic prostatitis, benign tumors, or even cancer. Everything will be based on medical statistics, clinical research, and guidelines from leading urology specialists. Brain, don't look away, because in just a few minutes, you'll know exactly when you should stay calm and when you must see a doctor immediately. First, we need to face a fact. Blood and semen, also known as hematospermia, is not an uncommon condition. But whenever you notice it, even just once, your body is trying to tell you, pay attention. Pushpin. Many people mistakenly believe that semen only contains sperm, but in reality, sperm makes up only a very small portion. Semen is produced by three main glands: the testicles, where sperm is produced; the seminal vesicles, which contribute up to 60% of the semen volume and contain sugars and nutrients to nourish sperm; and especially the prostate gland, which secretes fluid rich in zinc, citric acid, and enzymes to protect and transport sperm. Just a single small blood vessel in any of these organs becoming dilated, ruptured, or inflamed, whether due to vigorous physical activity, prolonged masturbation, excessive sexual activity, or trauma to the pelvic area, can cause blood to leak into the semen. Bar chart. According to a medical review in the Journal of Urology, up to 90% of hematospermia cases in men under 50 are benign, and usually resolve on their own within 1 to 2 weeks without medical intervention. DNA study at the University of São Paulo, Brazil, reported similar findings. More than 68% of patients under 40 with blood and semen had no underlying physical abnormalities. Most recovered simply by reducing the frequency of sexual activity or masturbation, resting appropriately, managing psychological stress, which can elevate localized blood pressure and cause abnormal dilation of small blood vessels. Light bulb. So, what does this mean? Backhand index pointing right. If you are under 50 years old and blood appears only once, without symptoms such as pain, painful urination, fever, or unexplained weight loss, it is most likely a benign physiological phenomenon and not a cause for major concern. But if you are wondering, could this be a sign of prostate cancer? When should blood and semen be treated as something that cannot be ignored? Direct hit. Then keep watching, because in the next part, I will help you clearly distinguish between a temporary phenomenon and a silent warning signal from the prostate gland, one that could change not only your sexual health, but your life going forward. But if you are already over 50, the situation is completely different. At this stage, any change related to semen, urination, or sexual function, especially involving the prostate gland, must be observed carefully and never taken lightly. The reason is very clear. After age 50, the prostate gland begins to enlarge, becomes more prone to inflammation, and is more sensitive to abnormal cellular changes. Sometimes, even a tiny streak of blood in the semen can be the earliest warning sign of chronic inflammation or even early-stage cancer. To make it easier to recognize, let's compare the two most common scenarios. Benign blood and semen, small vessel rupture. more often seen in men under 50 years old, usually occurs only once, then resolves on its own. Not accompanied by pain, blood in urine, nighttime urination, or urinary urgency. Usually unrelated to a history of chronic inflammation. Common causes include vigorous masturbation, excessive sexual activity, or minor trauma to the pelvic area. Warning signs of a serious underlying condition. If you are over 50 and the condition recurs multiple times, accompanied by a burning sensation when urinating, difficulty urinating, frequent nighttime urination, or a history of chronic prostatitis. Right arrow, this cannot be ignored. It may be a sign of a more serious underlying issue, particularly since the prostate gland has already begun to undergo age-related changes. Bar chart. According to a study published in the Journal of Urology, 2020, 70% of cases of prolonged blood in semen in men over 50 are associated with chronic prostatitis or early-stage prostate tumors. Brain, in other words, blood in semen does not automatically mean you have cancer, but cancer can begin with this exact sign. And if you ignore it, you could miss the golden opportunity to detect it early and treat it effectively before the disease becomes far more dangerous. So, when is blood in semen no longer a minor issue, but a warning sign that your body needs you to act immediately? You don't always need to panic, but there are certain signs that you absolutely must not ignore. Below are 5 red flag situations where, if you experience them, you should see a doctor as soon as possible. Red circle 1. Blood appears in your semen 2 or more times within a single month. This is no longer an isolated incident. If the bleeding recurs, your body is signaling an underlying condition such as chronic inflammation, repeated tissue injury, or abnormal blood vessels within the prostate or seminal vesicles. Red circle 2. Accompanied by a burning or painful sensation during ejaculation or urination. Pain is often a sign of inflammation or infection. If you feel burning pain when urinating or ejaculating, you may be experiencing seminal vesiculitis, prostatitis, or infection of the ejaculatory ducts. Red circle 3. Blood also appears in your urine, even if it's just once. This is an especially concerning sign, as it suggests the blood is not only coming from the ejaculatory tract but also involves the urinary system. Possible causes include urinary tract infections, polyps, or deeper lesions within the prostate or bladder. Red circle 4. You have persistent urinary symptoms such as nighttime urination, urinary frequency, incomplete emptying, or difficulty urinating. These symptoms are the written message from your prostate. Don't skim past them. They may indicate chronic inflammation, benign prostatic hyperplasia, BPH, or worse, a tumor compressing the urethra. Red circle 5. You are over 45 years old, or you have a family history of prostate cancer. After age 45, the risk of prostate cancer increases exponentially. If a family member has had the disease, your personal risk is even higher. In its earliest stage, prostate cancer causes no pain, no discomfort. It may only leave behind one subtle sign, a streak of blood in your semen. Stethoscope. In these cases, your doctor won't just ask a few questions and send you home. They will order a series of specialized tests to pinpoint the underlying cause, often including PSA, prostate-specific antigen, a simple but extremely important blood test. Elevated PSA levels can be the earliest sign of prostate cancer, even before any symptoms appear. TRUS, transrectal ultrasound. Using an ultrasound probe inserted into the rectum to clearly visualize the prostate gland's internal structure, detecting inflammation, fibrosis, enlargement, cysts, or even small lesions that can't be detected by physical examination alone. Pelvic MRI. If a tumor or deeper lesion is suspected, MRI provides highly detailed images down to the millimeter, helping doctors determine whether a biopsy is necessary. Direct hit, and the one thing you must remember is this. Not every episode of blood and semen is dangerous, but ignoring it can be. Because early-stage prostate cancer doesn't cause pain, swelling, or any obvious discomfort, except for one silent signal, a streak of blood in your semen. As you can see, blood in semen is not always a sign of something serious. But that doesn't mean you should dismiss it. If it happens just once, without any other abnormal symptoms, and you're still young, monitor the situation and stay calm. But if you are over 50, the symptom recurs, or you simply feel worried, do not hesitate to see a doctor. Backhand index pointing right, just one simple examination can either put your mind at ease or, more importantly, detect a problem early, something many men overlook until it's too late. Because sexual health is not only about sexual performance, it's also about your quality of life, your confidence, and your future. Direct hit, have you ever experienced this phenomenon?
How worried were you?
Speech balloon, leave a comment below, because your story might be exactly what someone else needs to hear right now. And if you found this video helpful, don't forget to like and share it with your friends or family, because chances are they may have the same questions as you, but have never dared to ask. I'm Alice. See you again in the next videos from Men Health 30. Taking care of yourself is never too late. And you deserve a truly healthy body from the inside out.